Greetings, it's Dr. Lippy Roy, and welcome to Hollywood, Florida. We're actually in a hotel room, so hence a bit of a drab background. But I am so excited to introduce my first guest. This is Dr. Ayana Jordan, MD, PhD, brilliant doctor, researcher, and addiction psychiatrist. And she's a professor at NYU School of Medicine. Welcome, Dr.
Thank
Jordan.
you so much, Dr. Roy. I'm so happy to be here with you today.
This is Health, Humor, and Harmony with Dr. Roy. I am
Amazing.
so excited to have launched this show. Folks, you're in for a treat. So, this is going to be conversational. Dr. Jordan is actually giving one of the major plenary talks this afternoon. We are so excited. I've had the honor of hearing her speak before. We are friends. We met through social media.
Yes.
So, this is so apropos, right?
Yeah.
So, Dr. Jordan, why don't
Yeah.
you tell viewers a little bit about you and the work that you do?
Sure. Thank you so much, Dr. Roy, for having me on as your first guest from Hollywood, Florida. I'm really excited to spend a little bit of time talking about my work. I really focus on racial disparities within addiction, and that's really important because despite using substances at the same rates, racial and ethnic minoritized individuals, Black and Brown communities actually have worsening outcomes. So, what does that mean? Is that they're more likely to die from their substance use. They're more likely to have infectious disease, hepatitis C, and HIV as a result of their substance use, and are now leading in the rates of deaths from drug overdoses. So, really, my work is trying to understand why. What can we do to prevent those deaths? And how can we respond in a compassionate way to get people into treatment in a way that is culturally informed? So, really happy to be here with you to talk about that work.
I cannot begin to thank you on behalf of all of my patients
Oh,
for the work that you do. And I know there are a lot of you because all of you write in, you send emails, you put posts on my social media pages. So when you're watching this, please make comments. Please join me on Instagram at Health Humor Harmony Dr. Roy. Please also be sure to follow Dr. Jordan. What are some of your social media handles?
yeah, it's the same across all platforms. At Dr. Ayana Jordan, at DrAyanaJordan. So follow me on Insta, follow me on Twitter. So happy to be with you today, Dr. Roy. Yeah.
Well, it is such a privilege, and I want to make sure that your voice is heard because the work that you are doing, it's quite literally life-saving. You know,
Yeah.
we when we go through medical school and training, we think of when life-saving, we think of diseases such as diabetes, heart failure, lupus, all very important, but we don't always learn about all the what we call social determinants of health, all these
Mhm.
other structural inequities,
Yeah.
which really are healthcare. I learned as a former primary care doctor to homeless men and women that housing is health.
Housing as health. So that is excellent because when we're thinking about what are the structural determinants, you mentioned one, housing. How about employment? Just being able to have a stable job improves health outcomes, right? So, how can we increase employment? And we know that because of policies from earlier on, Black and Brown people are more likely to be involved in the carceral system. So, that limits their ability to be able to work. So we want more compassionate policies to say, hey, if you're using substances, if you are in possession of substances, you need to be funneled to treatment, not be involved in the carceral system, because we know that will affect your ability to get housing, to be able to work, which ultimately will impact your health.
Yeah.
So the work that we do is we say, how can we help you if you have a drug problem? How can we help you not only deal with the substance use itself, but also attend to those social determinants, right? Like housing, like past offenses in the carceral system, like being able to work, because we know that's going to have an impact on your health. So, really just awesome that you're thinking about this on your program.
Well, and the other, Dr. Jordan and I, we will, I'm sure she'll agree when she'll say that we didn't learn these things during medical school.
At all,
And
at
both of
all.
both she and I are honored to have gone to pretty good schools and
Really great
great
schools.
academic programs.
Mhm.
Really no fault of their own, but I mean, I think a lot of these programs really need to change their curriculum so that young doctors, nurses, PAs, and NPs and medical professionals who are going to be caregivers learn about these problems, these
Yeah,
issues, just, correctional facilities, housing, lack thereof, lack of education, early childhood trauma, and how that
that's
increases
a big one.
our risk adversely in every
Mhm.
way. As a psychiatrist and who really understands health disparities and racial disparities to care, can you talk a little bit about how that early trauma, even to children who see, say, their mom, dads go to jail, get arrested, instead of getting humanitarian compassionate care, what does that mean and how can we fix that?
Yeah, so that is a really, really big one. And I'm so glad you bring it up. But we know, and definitely this is something that we deal with in psychiatry all the time, how to ACEs, really adverse childhood experiences, really impact the outcome of people who use drugs. And just like you said, we know just having that sensitization to having one family member in the carceral system being exposed to erratic substance use without getting treatment, but instead being sent off to corrections, can really disrupt someone's ability to form healthy coping skills, which often exacerbates substance use later in life. So
Absolutely.
even if they weren't the primary recipient of going to jail, but just witnessing that from their environment, that increases their impact of using substances.
Yes.
So one of the things that we really think about the Jordan Wellness Collaborative, which is the lab that I run, is how can we make sure that people not only get access to medical treatment, which is paramount, but also to mental health treatment.
Yeah.
We have to be able to address their psychological distress, right? Because of the trauma they experience, because we know that that can impact their lives. And another great point, Dr. Roy, that you brought up that I love so much is the point of learning about that in our schools. And it really is to no fault of the institutions, but a lot of medical curricular now are really integrating understanding those social determinants because we know more than anything that we prescribe, we have to deal with this. So I'm excited. Change is happening and it's happening in our lifetime. Be excited about it, guys, because we're a part of seeing that. Yeah.
I'm so glad you brought up optimism because, as my viewers know by now, they know that I'm dorky. I include humor and
Yes.
jokes, and despite the work that Dr. Jordan and I do, think about it. We could easily get really depressed
Yeah.
and angry
Yeah.
and frustrated because of all the injustice that we see and
Mhm.
unfairness. But instead, we choose to channel that anger and frustration in ways that I like to think are very positive and
100%.
impactful.
Yeah.
You can tell we're very animated, energetic, and positive people. We are blessed with education, with a
Yes.
lot of good support system and resources, and we're really just trying to pay it forward. And so through this information, we want to share it forward. And the last point before we go,
Yeah.
during this pandemic, there were certain events that happened, George Floyd, but that is not the first, and sadly,
Right.
it's not going to be the
Your
last.
last. Yeah.
And so we heard the phrase racism is a public health issue. It's a public health crisis. And Dr. Jordan, I know you've known about this for a long time.
Yeah.
Can you just tell the audience briefly what exactly that means?
Yeah. So when we're thinking about racism, the easiest way to really break it down is just ism race, right? A system based on race. And what that means is that people who are socialized as Black or Latinx are treated differently in the system if they are not part of the dominant class, which in this nation is a white person. So when we say a system based on race is a public health crisis, we know that it's not because of the individual themselves that they're resulting in worsening outcomes, but it's based on a system that treats them less than, right?
Yeah.
Not because they are doing anything in particular, but there are structural policies that make it harder for them to protect their health because of the social classification that they are assigned to. So, what we want to do is really bring attention to say, how do we help people who have been seen as or assigned to the secondary class access health in the same way that all people should um, be able to in this great country. And we want to really advocate for equitable policies. One of the things that Dr. Chinazo Cunningham said today that was so powerful in the opening plenary is, we have to be thoughtful about thinking about public policies through an equity lens.
Yep.
We know that all people are not treated the same because of these social classifications based on race.
Right.
So, how can we be proactive in thinking about enacting policies that are going to help everyone? And so that's what we mean. It doesn't mean that anybody should be treated, um, you know, differently or less than, but we want to make sure no matter what racial identification you belong to, that you have access to equitable outcomes. And we're excited to really do that and think through how to do that.
I gotta tell you, folks, this is the most articulate way I've heard this explained, this concept explained. And Dr. Jordan referenced Dr. Shanazo Cunningham, who is now the commissioner of the New York State OASAS, which is the Office of Addiction Support and Services, which is the New York State Addiction Agency, and really talked about harm reduction and how we need to use these evidence-based policies, which includes harm reduction, access to medications that we know
Oh,
can
word.
be effective,
Yeah.
and connecting people to support services, family, friends, peers,
Yes.
you name it. And of course, education, jobs, housing. We don't think of that traditionally as medicine,
Mhm.
but they are all critical aspects of our health. Folks,
Absolutely.
I just want to say, join me in giving applause to Dr. Ayana Jordan, who's I'm so lucky to call my friend and my colleague in this important space. Thank you, Dr. Jordan, for taking time out of your busy
Oh,
schedule.
anytime, Dr. Lipi, when you call, I am there. This is awesome. Thank you for all the work that you do and public facing information so that people know what are the hot topics. I appreciate you
High
immensely.
five.
Yes.
Thanks, folks. And be sure to tune in Monday, Wednesday, Fridays, 3 p.m. Eastern. All of my shows next week will be, this week, actually, sorry, are going to be devoted to the ASAM conference and all the amazing speakers and topics. Thank you. And remember to follow me on Instagram at Health, Humor, Harmony, Dr. Roy, and subscribe to my channel. Be well, be safe.